Hey everyone, Dr. Donovan here. Excited to talk about a simplified analogy that I like to use for my older adults in regards to their health as we age. When we're younger, we don't necessarily think of our health as something that we're going to lose. And over a period of years, our health starts to change. It might get better, it might get worse, but this concept of the lifespan of health is the idea that we all are entitled to this full tube of toothpaste, and that we want to squeeze every last healthy year out of that tube as we can. And that involves staying at the highest level of function for as many years as possible. And right now you might be thinking to yourself, you might compare yourself to peers of your age, friends, brothers, sisters, and that's well and good, but I want to make sure there is some objective measures. So not just I am in better shape than my brother, so have a good health span, but the lifespan of health encompasses these many years that we are in a high percentage of function. We use this scale here. So there's 4 different tiers of health. At the top, which encompasses the top maybe third or 40% of our health span, is this fun stage. So in this fun stage, we're playing with our grandkids, we're traveling internationally, we're pretty much doing everything we were doing 10 years prior. And then in the functional stage, things become a little bit more difficult. We might see more healthcare practitioners at this stage. We might need some outside help to maintain the ability to keep up with our children on a vacation. And then we really start to get a little worrisome in the frailty category. So in this category, we've started to accumulate more and more disease. So the biggest predictor of chronic disease is aging. So no matter what, we're going to accumulate disease as we get older. You're going to see less and less people that are just having an aspirin every day. They might have medications in the morning and evening, things they take every other day, doctor's appointments every week. And that's going to be encompassing kind of the frailty category. You're going to have a limitation in how far you can walk. You're not going to be able to keep up with your kids or grandkids. And those are really where people tend to come into my clinic in this frailty stage, where their back's been giving them trouble, their knee's been giving them trouble. They just had a shoulder surgery, and they're really noticing that they're having a hard time bouncing back. And that's really where people come to me in the physical therapy realm. But I'm hoping to meet people more in that fun and function realm, because that's where we really get to maintain this high level of health span. And it's a challenge to improve these categories once you dip into the lesser percentage of your health span. So if a challenge that I have for all of you in this series and this coursework is to improve by one category. And who is going to help you? How are you going to do it? Does it going to just take an extra walk a week to go from function to fun? Or are you doing everything you want to do? You're playing the same sports, you're still playing tennis, and you're in that fun category, then don't even worry about it. But my message to you all today is to get the most out of your health span, squeeze every last drop out of that toothpaste bottle, and you'll live a full and active life. And that's today's message.